Hello, welcome back to this channel. My name is Joel Msando, and today we are going to discuss the meaning of HIV, its origin and the three main stages of HIV, common symptoms, and the immune defense. HIV is an acronym which stands for Human Immunodeficiency Virus. HIV infects cells of the body which defends you from various infections. Currently, we do not have effective cure for HIV, but we have antiretroviral therapies that helps to control the HIV infection. AIDS occurs when HIV is not treated. AIDS is an acronym which stands for Acquired Immunodeficiency Syndrome. So, where did the virus come from? Maybe someone might be interested. What's the origin of HIV? So, HIV origin is not clearly understood because it's just based on various theories. Like in Africa, most African scientists argues with their fellow counterparts from Europe, saying that the virus originated from North America. So most scientists from Europe base the argument on the fact that the virus came or originated from Central and Western Africa between 1930s and 1940s, when the locals used to hunt chimpanzee for meat. So the virus that is always present in this chimpanzee is called the simian virus. So it jumped from the chimpanzee to the locals when they consumed meat which contained blood that is infected with the simian virus. So once the simian virus got into their bodies, it changed into the human form of the virus, and that is the human immunodeficiency virus. Okay, so in case you test positive for HIV and you fail to take medication, there are three main stages that will take place. That is acute HIV infection. So during the acute infection, there is always high viral load in your blood, and you will be more infectious at this stage, and the common symptom is usually a flu-like symptom. Then this will be followed by the chronic stage. The chronic stage is also referred to as the asymptomatic stage. Why? Because there are no symptoms during the chronic stage. You are still infectious, but the symptoms are not there. So you can only know your status by getting tested. Then we have AIDS. AIDS is the last stage of HIV infection. So HIV is not AIDS. AIDS only occurs when there's no treatment and the immune system is weak. So the body is susceptible to various infections that the body can always defend itself from. Okay, so we usually refer to this as opportunistic infections. Yeah, when your immune system is low, they make good of that opportunity and attack the body. So they are the opportunistic infections, and they only occur at the AIDS stage. So the common symptoms that are usually seen during the acute phase of HIV infection includes we have fever, we have sore throat, we have swollen lymph nodes, we have a rash, then we have muscle pain, we have fatigue, chills, mouth ulcers. There's also night sweats. So remember, these are just symptoms and they are also similar with other diseases. Okay, so the only way to get know your status is you have to get tested. So you can't rely on symptoms alone. So you must get tested first. So we'll do a brief description of the immune system of man. Okay, the human body is like a country. Remember, a country has a defense system. We have the military forces. Okay, then in a country we have our borders, which are protected by the police, by the military. So for you to get into a country, let's say you want to go to South Africa, you need to pass through the immigration department first before you get to South Africa. Then we have the police commission that also help to defend. So in case an enemy attacks a country, they will not directly attack the citizens. They will attack the military. Once the military has been attacked, the country tends to be weak and susceptible to other attacks from weaker enemies. Okay, so the body contains cells. These cells are the ones that act as the military of your body, so they protect you from various infections. So HIV attacks these cells. That's why for those people who test positive for HIV, there are various tests that we do in the lab. So one of them is the viral load. We count the number of viruses in the blood. Then we also count the number of cells that protect you from infections. We call them the CD4 cells and the CD8 cells. They help us to know how your body is responding to the infection, how your body is responding to the antiretroviral therapy. So these are the cells. So the barriers of your body are like the skin, okay? The skin and the mucous lining of your mouth, the vagina. So they protect you from infection. These are the barriers that in case of, let's say, a burn, you become more susceptible to infection. So they also protect you from various pathogens. Then we have the molecules. The cells of the body produces various molecules like antibodies. An antibody helps to fight infection. So antibody is a molecule. Okay, so antibodies help to prevent HIV from attaching to the cells. So the molecules, which in this case I will refer to them as the policemen, the police commission, they help to identify the thieves, they help to identify the intruders before they cause harm to the society, to the community. So that's actually what the antibodies does in your body. So in summary, you know what's the meaning of HIV, and you know the reason why you need to take HIV medication in case you test positive for the virus, and the various symptoms and HIV stages that we have learned today. So our next discussion will be on the myths surrounding HIV infection. Thank you for your time and thank you for watching. Goodbye.